Okay, it's 2 minutes after high noon, so we're going to get started. Welcome to our State of Health webinar for our employees at the state and all agencies. Exciting to present this to you, and we've really been having a great time working with employees. Our health coaches have been working with employees since March, since the beginning of the program. By the way, I'm Steve Halterman. I'm the wellness manager for the state. I work in DPA. And let's go on to the next slide where just want a few things to keep in mind. We were going to try to do a hand raise function, but we've got a lot of participants. So we're just going to do the where you can submit your questions, and my colleague Meg will go through those and help me out with those. And we'll try to answer as many of your questions as we can when we get to the Q&A portion of the webinar. So again, use the chat function, and we'll do our best to get everything done. To change the size of the presenter or interpreter, just hover your mouse between the slides and the presenters, and the sizing bar should appear. It'll give you the option to adjust your screen accordingly. All right, I hope that works for everyone. And we are recording this. It's a live session, and we do have an interpreter and closed captions. So I think we're all set to go. So let me go to the next slide. What we're going to talk about today is really, we're going to talk about state of health and help you understand what it is, how it works, who's eligible for the program, how you can apply, submit an application to participate, and we'll talk a little bit about the timing of the applications, the enrollments. I'll describe a little more about how the year-long program works to help you improve your health. And also just got a couple slides I want to talk about how your supervisors can encourage and support your participation if you're participating in the program. And I'm sure there's probably some supervisors on here, so that should be helpful to you as well. Okay, what is or why State of Health? Why do we offer this program? So really, we have some aims at the state, and our aims are to, of course, get our employees access to quality health care so that you can achieve your goals and reach an optimal state of health. And that's really where the name comes from. It's got a double meaning. We are the state of health in Colorado, but it's really focused on helping you improve your state of health, regardless of where you are. We're doing in the pilot version of the program right now. And after that's complete, about July of next year, or somewhere between March and July of next year, then we're planning to roll the program out to all employees, regardless of health risks. We can have those with multiple chronic conditions, one chronic condition, or no chronic conditions, and really just trying to stay healthy. So that's where we're going to be after the pilot. Right now, we're in the pilot. In the pilot, we are focusing on employees who have the greatest need for the program. And one reason this is important, it's an opportunity for us to fill gaps in care, and especially for those who have experienced health inequities. So we think about the chronic conditions like diabetes and tobacco dependence and depression, hypertension. There have certainly been some inequities as far as getting people the right care, access to care, and we're really trying to bridge that gap and go closer to health equality. So that's why we offer State of Health. And I'll just say, being relatively new to the state, about a year now, it's quite refreshing to meet with our leadership and see how receptive they are to offering a program like this. It's a program that does take a lot of resources, and the state was willing to really look at this and offer it to employees just because of those reasons, because we can help those who have the greatest need for the program, but also to meet our goals of providing a health program for everyone. So who is eligible to participate? You're eligible if you're an employee of any agency of the state of Colorado and you're enrolled in the state's health plan. And we have two different partners for our health plans. We have Cigna and we have Kaiser Permanente. So if you're in either of those plans through the state, and this is real important, if you're willing to fully participate in the year-long program. Okay, so really, what does that mean? Are you willing to take action and do some things to improve your health? So just for the program, that involves attending the health coaching sessions. We've got these skill groups where you can share with other employees, work with your either Everside or Kaiser physician, and engage in those healthy lifestyle activities, exercise, nutrition, stress management. It's not limited to those things. And finally, the last eligibility element is having one or more of the following conditions. So there are 10 conditions that we've opened this up to, and as long as you have one or more of these, then you would be eligible if you meet the rest of the criteria. It would be diabetes, pre-diabetes, if you have high blood sugar but not yet diagnosed with diabetes, and hypertension, high blood pressure, obesity, and we use a cutoff of a BMI of 35. Okay, so that's the category of obesity, if that's how you what you want to join for. Abnormal cholesterol, depression, tobacco dependence, anxiety, asthma, and chronic obstructive pulmonary disease, COPD. So any of those conditions the program is built to help you with your whole health. So a lot of our participants will have a number of those conditions, and we're not going to limit your care to just one. And we're really looking at your entire state of health and helping you to meet your goals for that. Okay. Now, so when can you apply for enrollment? The first 100 participants were enrolled in the first phase with Cigna and Everside. And we started that in March, and we just finished closing that up to new enrollments. And now we're going to enroll another 100 to 150. We'll see what we have capacity for to start in August and September. And that now includes a limited number of employees who can participate in the Kaiser program. Right now, we actually only have one health coach with Kaiser. We will have more. So we're only going to enroll about 25 employees who are Kaiser members, and then probably another 100 or even more who are with Cigna. So that's kind of where we are. If you submit an application and we've already reached the max for this cycle, we'll put you on the wait list and guide you to some resources in the meantime before you get started with State of Health. We really want to make this as inclusive as possible, but we do have limited resources right now. We have an amazing team of health coaches through Everside, through Cigna, through Kaiser, and through our own CSEP, internal EAP. So really looking at a broad approach to health. So if you have submitted a request to the wellness inbox, many of you have, and you've heard back from, I'm the guy who's responding without my name, just wellness inbox, and asking more information, and have been getting your names to the health coaches to reach out to you. If you've submitted an application, then we're going to likely enroll you for the August, September until we reach the capacity. So those who aren't enrolled yet, then we'll start probably in January. We might try to do something before, but we're really trying to balance the needs of everybody.
Steve, we have a few questions in regards to this. So first question is from Faye. Is the program open to those who are no longer a state employee, retired, but who are covered on a spouse's insurance plan?
Wow, good question. You might not like the answer. So to be eligible for the program, you do have to be an active employee of any agency of the state. So even if you're on one of those health plans, but it's through a spouse. Now, if you are an employee and you're enrolled as a dependent, that's okay, but you have to be an active employee to start the program.
Great, thank you. It sounds like we have a few similar questions in general. Where do you apply? How do you apply? I believe we're going to discuss that later, but I wanted to give the opportunity to ask that question.
Yeah, no, those are excellent questions. And yes, we will provide you with the link. We now have an application link, and our website has gone live. So I'll get to that in one of the slides coming up. It's exciting, and you can get all kinds of information about the program at our website. I'll give you that link as well. Okay, let me go on to this slide, and Meg, let me know if there's more questions that are relevant to where we are. So this is really important. State of Health is a unique program. It is, you may have experienced some health coaching in the past where maybe you had a session or two with a health coach, and they asked you what your goals were and gave you some helped you to attain some skills to really get healthier or meet those goals. This is different from that. This is a very structured program, and that's why it's a year-long program. And beyond being structured, it's very focused on helping you to really look at bigger picture elements. And we call it going further upstream and looking at determinants of health. And so one way we can explain that is, well, State of Health will help you explore areas of your life that have prevented you from making lasting changes. And that's probably most of us have tried to make changes to our health at one time or another. And maybe we were successful for some time, but then life happened and we, maybe weren't stopped doing the things that we were working for us to be healthy. So this program really gives you that support. You'll have your own personal health coach. Your physician will be involved. Your coach and your physician collaborate together. In fact, at least one session you'll have with both your physician and your health coach together to talk about the action plan that you're going to develop through the program. The skills groups are just really a great opportunity. There are multiple subjects on exercise, nutrition, stress management, healthy communications, understanding your biometrics, and really just having those discussions. You'll gain some information, you'll gain some skills, but you'll also be able to hear from other employees who are having similar challenges. And that's one of our goals with State of Health, is to connect you with other participants who are employees of the state and in the program. So what's important, we talk about it as being a one-year program. So 1 year is kind of like, that's the magic number in science for if you can reach a year of sustaining changes, then it's likely that you're going to continue those efforts for the next year. So, but we do know that, again, life happens. So it's a year-long program. You'll meet with your health coach several times in the first 3 months, and then you'll have follow-up sessions every 3 months until you reach the year. Then you'll graduate from the program. Hopefully you'll be successful. I'm sure you will. And then you'll have the opportunity to still participate in certain elements. One really cool thing we have is what we call the State of Health Champion. So if you're a successful completer of the program, we're going to invite you to champion State of Health, promote it in your agency, and maybe even serve as a mentor to some of the new participants in the program. And that's a great way to, once you've made some changes, to help you to keep making those changes if you're helping other people. So Motivate Me, that's in there. We don't really lead with that because really this program is for those who want to do something about their health and are ready to make some changes. But you do get points for it as well. So if you're in state of health, you'll get the maximum Motivate Me points for that year. And then when you complete state of health, you'll get the maximum 240 points for Motivate Me for that year. And then continuing, we still have to develop after that, but we will have continuing points available because this is really our main health improvement program throughout the state, and we want to reward you for your participation in that. Okay, I'm going to move on to the next slide. So what is included in state of health? So again, talking about that upstream, psychosocial health, the things, your beliefs, your attitudes, social norms, your environment. We focus on your self-determined needs and goals. And that means really that you create your plan. Your health coach is going to be there to help you, but they're going to give you a whole action plan that you create. It's got a framework, you create it, you'll journal, you'll put the things together that you want to do to be healthy, how you're going to exercise, how you're going to have a healthier diet. We don't like to call it diet, but focus more on nutrition and healthier eating, and manage your stress, manage your sleep. That's an important part that a lot of people overlook. And really work with your primary care physician to manage any of those chronic conditions that you have. So again, it's all a collaborative, integrated program, the health coaches with the physicians. And Kaiser, we're excited about having Kaiser now because that is the model that Kaiser has. They are the health plan and the healthcare provider. So this was a natural fit for Kaiser to work with us to develop the program that the state has put together. There are 9 health coaching sessions throughout the year, and that tandem session that I talked about with your primary care physician and your health coach, and you'll get health assessments, health status assessments, where you'll complete a survey about your behaviors around exercise and nutrition and all those areas. But you'll also go into the clinic and get you got to get up your blood drawn. But that's going to help you to see where you are when you start the program. It's going to measure your cholesterol, your blood sugar, your height, weight, blood pressure, all of that. And we know what your starting point is. And then every 90 days throughout that first year, we're going to do the same thing. And your health coach is going to look at those results, talk to you, see where what kind of goals you have to meet your needs to improve some of those measures. And that goes on through the first year and then annually thereafter. And there are also optional elements that we offer to participants. Some of those are with the Cigna program. We've been offering OMADA has programs for diabetes prevention and diabetes management, hypertension, and weight loss. And then if you do join and tobacco dependence is one of the areas that you'd like to work on, then we'll also, in addition to having your state of health coach, you'll have a quit line health coach. Maybe it's through the state, the Colorado quit line, or it might be through Cigna's quit line. We'll see what works best for you. All
There's
right,
a few
so that's
questions, sorry, just in relation
Yeah, sure.
to that. Really quick. So Kelly asks, do you have to discontinue care with your current physician, for example, if your PCP is different than your endocrinologist, for example, can the program be with the specialist?
Yeah, that's a good question. So the short answer is no, it can't be with a specialist, and the reason for that is this is a primary care program, and your endocrinologist, of course, continue that care, but for specific to state of health and helping you to assess your health status and put together your action plan and have a physician support you specifically with that and work with your health coach, you would need to work with either an Everside physician or a Kaiser Permanente physician. You could still, if say you're in Cigna and you haven't yet signed up for Everside, then you can still continue your relationship with your non-Everside primary care physician. But for the elements of state of health, it will be important to also work with that Everside physician, and they're great. You know, and they've got locations not everywhere, but we have virtual elements, and most of state of health is delivered virtually. So even if you're in an area where you don't have good access to an Everside clinic, we could probably still connect you with an Everside physician who will work with you on state of health and collaborate with your existing physician.
Awesome. A few more questions. This one is pretty popular. Will coaching sessions be required in person, or will virtual or online be allowed?
Yeah, great question. So yeah, we are right now, we're at 100% remote, and that's primarily due to COVID, but also we've learned that we can deliver the program effectively in a remote setting. Not telephonic, because it's hard to engage, but using video conferencing like we're doing now, the health coaching can be very effective, and you can get to know your health coach and your provider. So everything's delivered virtually, except for, of course, when you have to get your biometrics, your blood drawn, you got to swing by the clinic for that. We will develop some on-site elements as the risks for COVID diminish. We will start to have some elements of the program on site, but if what you want to do is entirely virtual, then you'll have that option.
Awesome. And then just we can do one more since I know we need to keep it moving. But Jack is asking, if you sent an email asking to be added to the list but never heard back, what do you need to do next?
That's my fault. So if you haven't heard back, you will hear something. We got very overloaded with requests. So I've been working with those who submitted emails to really learn a little bit about your situation and then connect you with a health coach. And so they will be calling. We finished the enrollments. We were enrolling some of you who had submitted a request since the all-employee email, and now we've stopped those. But we're going to start next week again, making calls to everybody first who submitted a request for the program. So please, be patient with us. We couldn't call everybody right away. We really needed to look at what capacity we had and the timing.
Awesome. Okay, we can continue and we'll tackle some of these in Q&A.
Okay, thanks, Meg. So this graphic we have up here, this is really just it's a visual of the year-long program to really help you get a good picture of what's involved. There are 9 steps in the program throughout the year, and the first 5 or 6, actually, the first 6 steps happen in the first 90 days. So we start off with this intensive program in the first 3 months where you're attending the skill groups and you're working with your health coach. You probably meet with your health coach every other week or every 2 to 3 weeks, and it'll be good to get to the skill groups, every other week or even every week if you're able to do that. And because those skill groups are designed to help you develop your action plan. And then after that 90-day review, then you move into the supportive part of the program, and we'll still have the skill groups that you can attend, but you'll then meet with your health coach every 90 days. And again, those biometrics, they'll ask you a whole bunch of questions about what you do for your health and measure your progress. And it's really a neat thing to say, hey, wow, I started here and now I've it looks like I've completely reversed some of the problems that I've had. And employees with diabetes, you should know that reversal of diabetes is possible. It happens every day, and that can happen based on where you are when you start. You could have the opportunity to improve your blood sugar down to pre-diabetic levels, and you would work with your physician to de-prescribe your medications so you don't need to take diabetes medications, and then you've reversed the condition. And that's really what we aim for in State of Health, really help you. If that's your goal, we're going to do everything we can to help you meet the goal of full reversal. So supportive program, and then the maintenance phase. Phase 3, once you reach 1 year, you've completed, you've graduated, now it's maintenance. And we know we can do a whole lot of things to be healthy, but if we stop doing them, we're probably not going to stay healthy. So the goal is to really help support you in continuing those efforts and all that success that you had in the first year. Okay, and you can see that there's coordination with your Paladina. That was the name that we used to use for Everside. They changed their name, so I should probably change the slide. But that's really what we do is continuing care. Whatever care you're getting to manage your chronic conditions, you'll continue that, and it'll integrate with what you're doing with your health coach. So let's think about how this helps our teams and productivity, because that's an important thing to all employers. And at the state, we a lot of employers are going to look primarily at healthcare costs and look for ways to reduce costs. That's really not the position of the state. The state is to offer an excellent employee benefits program with access to healthcare and ways to help you to improve your lives. And so what State of Health can do, it can help you better manage your chronic conditions or reverse, like we just said. It can help you to feel more connected to the team. Again, we have those groups and the champion role, and also just with your coworkers and feeling good about yourself and working. Well, when you get healthy, you have less of a need for unscheduled absences. So that's a good side effect of the program. We do actually we prevent and we reduce safety risks or incidents. The healthier you are, the less likely it is that you'll have a safety incident. So that's a good thing for the state and your agencies as well. And then really, be more engaged in work. So if I'm really concerned about managing my chronic conditions and it's not managed well, I'm probably not going to be able to focus as much on my career and all those cool things and my family than if I am healthier. So being engaged in our work and our families and our lives is another great side effect of this program. And so as far as health insurance costs, yeah, it will help us control those costs so that we can continue to keep the costs low for you to continue to participate in those plans. And the next slide, as I said, I was going to talk about supervisors and leadership, and our leadership has endorsed the program. In your agencies, we worked with some pilot agencies, and some of them really went to great lengths, like CDLE, OIT, and a few others, and got a lot of employees enrolled in the program, and they're already successful. Now we're opening this up to essentially all agencies that participate in the health plan, and what's important is a lot of this is going to happen during the day, right? So your health coaching, your doctor's visits, the groups are essentially done during the day. And while we know that sometimes it might be difficult, we are encouraging supervisors to really work with you to make sure that you can get to those sessions. It's not a whole lot of time, because we know that you're going to be putting a lot of time in outside of work, doing your exercise, meal planning, and all of those elements. So it's important for us to make sure that we can give you access to those groups. They're usually held at lunchtime, 12 to 1, and you'll have some flexibility with your health coach to schedule your sessions at a time that works throughout the day. So really, as much as our supervisors and leadership can support you, the better. But do keep in mind, it's a new program. It's still a pilot. So it hasn't been fully communicated, and not every supervisor is going to even know what it is. So it is important for you to let your supervisor know that you're participating. They don't need and they shouldn't know why you're participating, just that you are participating. They don't need to ask you questions about your health, but you're in it, and it's an important thing for you, and you'd like to be able to fully participate in the program. And I hope that everybody gets the full support. I know we'll have some communication challenges, but we'll get there. You know, some of our agencies do a lot of different things for wellness and for employee health improvement. Um, I just caught wind of one of our very own agencies is the healthiest employer in Colorado. So Department of Natural Resources, congratulations to you. And you're really paving the way, and hopefully some other agencies can really look at some of the things that you've done to reach that. So that's where we aim to go. And let's see, I think that brings us to your enrollment. So here's our website, and we just went live with it. We've been developing it for some time. It's www.coloradostateofhealth.com or .org. Either will get you there. I know it's a long thing to type, but once you get it in there, just save it to your favorites, and you can always check it out. The website gives you information. There is a tab that says log in. Just ignore that for now. Participants will get an account to log in once they enroll in the program, and that will be a place where they get a lot of their resources. But for now, you can go to that website, learn about the program, and that enrollment link is there. Or if you just want to, if you just have some questions and aren't ready, might not be ready to enroll, you can submit a question through the website. If for some reason you can't get to the website, you can always send stuff to state_wellness at co.us, the wellness inbox. So these are the links, and I guess so. This link, Meg, can I just ask you, is this presentation going to be available to everybody?
Yes, I was actually about to type that in. So we will make sure that we share these slides on our wellness page on the DHR website, in addition to the recording of this presentation.
Excellent, great. So that's how you'll get to the link. It's a very long link, and it's you'll when you go to the link, it'll ask you for your consent to participate. We'll ask you some information about your health, and it's all entirely confidential. We, in addition to being the wellness manager, I'm also responsible for HIPAA compliance. So we take that very serious. Your privacy rights are important to us, and we make sure that your information is never provided to your employer, your agency. It all stays within State of Health, the health coaches, the healthcare providers, and the program management. All right, so that's brings us to the Q&A. If there are more questions, I'm happy to answer any questions you have. And let's see, are there any right now, Meg?
I'm going to actually just ask a few that were asked earlier that we didn't get a chance to get to.
Yeah, sure.
So these have to do with Everside. One question, how do you find an Everside physician if you live in a rural community?
How do you find an Everside physician if you live in a rural community? I would say for now, we'll set up a better process for this. But for now, just send me a note to that wellness inbox, state_wellness at co.us. Just shoot me a note, and I'll connect with Everside and let me know where you are, and we'll see what we can do about getting you connected.
Awesome. Okay, another question that has to do with Everside. If your PCP is an Everside physician, can you keep that doctor, or will you be asked to move on to a new one?
No, you'll continue to work with the PCP you have now if they're with Everside. Absolutely. All Everside physicians are now participating in this program. So that's important that you continue that relationship.
Awesome. Let's see, I'm just scrolling down. Okay, it sounds like there's already a wait list if people expressed interest when the all-employee email was sent out. When can they expect to be able to participate?
Yeah, great question. So we sent the all-employee email out. I think it was June 14th. So yeah, basically a month ago. And that went out to all employees. And then some of the agencies also sent the message out, like CDPHE. I got a whole lot of you from CDPHE asking about the program, as well as several of the community colleges. And so you should expect to receive probably a call from one of the health coaches within the next few weeks. So starting next week, we're going to make those calls to do the enrollments, and that health coach will walk through the program kind of like we did here, but in some detail, and answer some questions. And they'll ask you about your health status and your willingness to participate in the program.
Awesome. Another question, if you are not ready now, will there be another enrollment period next year?
Absolutely. Yeah. So we're going to enroll more employees probably starting in January. We might start doing the enrollment at the end of the month, and then you'd start in January. December is tough. And then we're going to basically every 4 months, we're going to enroll a new group of employees in the program.
Awesome. Question about personal email. Can an employee use their personal email account instead of their state email?
Yes, you may.
Awesome.
Just when in the application, just provide your personal email address, and we'll use that.
Another question sort of in relation, how are you balancing the HIPAA concerns with the supervisor communication you mentioned before? Can you participate without sending information through their CDE email? Or can I participate, excuse me?
Yeah, so I guess the question as far as balancing HIPAA is where you submit your application, that's a HIPAA compliant, secure link through Google Forms that nobody in your agency has any access to. I can't say as far as our email addresses from the state, but believe me, we have some very strict protocols around protecting your privacy. So when you submit the application and the link, that's entirely secure. And if you send something to the wellness inbox, of course, that's limited. I'm actually the only person who opens the wellness inbox. And any part of the program with respect to your supervisor knowing that you're in the program, I mean, it's important that they know so they can support you. If you just don't want to tell them, that's up to you, but that might limit your ability to participate during the day if it's during your shift. So I think that's about it. If you have specific questions on that, feel free to reach out to me.
One question, should we sit tight or fill out the application? I believe that
I'm going to say,
in response to that earlier conversation.
I'm going to say fill out the application. It's essentially it's kind of first come, first serve. So if you get one in today, it's much more likely that you'll get enrolled to start in August. And then we'll see where it goes from there.
Another question, at what point do you determine our insurance enrollment? I didn't see that on the application.
At what point do we, in the Well, if you submitted a question to me through the wellness inbox, you probably got a questionnaire from me where I asked you which health plan are you in? Are you with Everside? And what's your level of motivation? And a bunch of cool stuff. For the actual application link, then that so the application link is just built so that you can submit that information, and we will take that and respond to um, those who apply.
Great. Just a few more questions, it looks like, unless more come in. In a rural community, after we make contact with you to be set up with an Everside physician, do we have to replace the Everside with our regular family physician?
No, you do not. Some people may decide that they want to, but it's certainly not a requirement. The only real requirement is that you use the Everside physician for your participation in State of Health. And it's, we try to be, we've really made an effort to make the program as inclusive as possible. But the challenge with outside physicians is we can't train them about our program to coordinate and collaborate and share information in the medical record as we can with, say, if you're in Kaiser, that's all built in. And with Everside, it's all built in as well. So that's really the reason for that. And the Everside physicians are amazing. I've worked with them and introduced the program to them back in January, and so many of them were so pleased that we're offering this, and they started reaching out to some of their patients and said, hey, there's this new program through the state. If you'd like to get referred in, let me talk to you about that. And so we got a lot of referrals from those providers.
If your PCP is an endocrinologist, will you still need to go to a different physician?
I believe that if they're an endocrinologist, they're not likely with Everside, but maybe I'm wrong. So if they're with Everside, you're good. Or if they're with Kaiser and you're in Kaiser, you're good. And that's, yeah, that's pretty much where that is.
Cool. This is the last question so far. The application doesn't ask which plan you're in, so how do we get that info to you? Will you follow up on the application?
Oh, that's a good question, because I was sure that I put that in there, and if I didn't, then I need to fix it. I will. I'll look at the submissions and we'll. I mean, we have the records of Kaiser and Cigna, so we might just look it up if we can.
Cool. That is all for now. Oh, I do see another one. Obesity is not listed as a condition on the application.
Well, thank you for letting me know. I'm going to fix that right away. If that's the case, then I think there's a section where you can make a comment. But I'm going to look at that link right away after this call, and I will make those two changes. One, to add obesity, and two, to add the question about your health plan.
Great. And then Jacqueline did want to mention there isn't a comment section available, so you also might want to update that.
Okay.
Another question, I missed the part about the email address. Can we use our personal email address?
Yes, you can use your personal email address. Not a problem.
And with these updates that you're making to the application, will this require people to resubmit the application?
No, don't worry about it. I will get the information. I may end up reaching out to you, or have one of the health coaches reach out if we're missing anything.
Great, thank you.
Sure. Is that it? Any more questions?
It looks like that's all for now.
Okay, well, then we can wrap up early, and you can have some time back. It's about 12:45, and yeah, thanks for joining and listening, and look forward to getting a whole bunch of applications and enrolling as many of you as we can to help you with your health improvement journey.
Thanks, Steve.
Okay, thank you. Bye now.